Now for the next thing, which we're trying to actually look at, the you know basically applications and all of that, is the area of what C-reactive proteins and of course acute phase proteins in orthopedics. Okay, so what are the applications of these things in orthopedics? All right, so of course, if you know C-reactive proteins and acute phase proteins, it's basically what they will rise up, okay, when there's like an inflammation or so, you know. So for what we got here, we said that they're actually very important laboratory tools, and they help to now dictate if there's an inflammation, if there's an infection in a tissue, or if there's any injury, you understand. So C-reactive proteins, to be particular, is the one that we always use, do you understand? So that's why we're actually discussing it especially. So it's a sensitive marker of acute inflammation, and the levels should rapidly rise within 6 to 8 hours. So just after injury, the levels usually used to rise quick, and the levels also falls quickly after the inflammation is going away. So I can also use C-reactive protein to now what be studying how a particular patient is healing from a particular condition. Do you understand? So other acute phase proteins include all those erythrocyte sedimentation rate. Have the serum amyloid A, you have the fibrinogen, have the haptoglobin, you have the ferritin, have the alpha-1 antitrypsin. Then also the albumin and transferrin, they are also very important there, so just help you indicate. So their clinical application in orthopedics is, I can now be using this thing to actually diagnose all these inflammatory conditions like osteomyelitis, septic arthritis, prosthetic joint infections, Then I can also use it to monitor post-operative recovery. That's somebody recovering after, surgery, major surgery. I can use it to diagnose all those inflammatory issues like rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis. Okay, I can also use it to actually confirm, all those trauma, maybe stage it. Okay, look at the extent which the trauma has actually affected, the bones. Can use it to also confirm tumor and bone disease.